Good morning, everyone. The topic of today's group discussion is culture bound syndrome. My moderator is Dr. Sanjeevni. So, culture is defined as a set of meanings, norms, beliefs, values, and behavior patterns shared by a group of people. These values include social relationships, language, non-verbal expression of thoughts and emotions, religious beliefs, and rituals. The culture is learned, it can be passed, helps in shaping and orient future. Now, what are the components of a culture? Culture is learned. It can be passed on from one generation to the next. It involves a set of words, behaviors, events, symbols whose meanings have been tactically or objectively agreed upon by the cultural group. The culture acts as a template to shape and orient future behaviors and perspectives within and between generations and to take into account of novel situations encountered by the group. It exists and evolves in a constant state of change, includes patterns of both subjective and objective components of human behavior. Now, this is also known as culture-related specific disorder or culture-specific disorders or syndromes. And the culture-bound syndromes are a collection of signs and symptoms which is restricted to a limited number of cultures, primarily by reasons of certain of their psychosocial features. The definition was given by Prince in 1985, and it denotes specific arrays of behavioral and experiential phenomena that tend to present themselves preferentially in particular socio-cultural contexts and that are readily recognized as illness behavior by most participants in that culture. Culture-bound syndrome was first described in Kraepelin textbook of psychiatry, the 8th edition in 1909, and it was the Chinese psychiatrist Yap who first introduced this term in 1969. Since first this was described outside the West, so they were thought to only exist in non-Western countries and in non-Western conditions. The culture-bound syndrome was also mentioned in the story of Dhar by D. Bhugra et al. In 2004. Now, according to DSM-5, they are cultural concepts of distress, which refers to ways that cultural groups experience, understand, and communicate suffering, behavioral problems, or troubling thoughts or emotions. Now, how does this culture contribute to psychopathology? Firstly, it has pathogenic effects. The pathogenic effects refers to situations in which culture is a direct causative factor in forming or generating psychopathology. Cultural ideas and beliefs contribute to stress, which in turn produce this psychopathology. Pathoselective effect, tendency of some people in a society when encountering stress to select certain culturally influenced reaction patterns that result in manifestation of certain psychopathologies. For example, the family suicide. This has been talked about in the further sections of the presentation. Now, pathoplastic effect. Pathoplastic effect refers to ways in which culture contributes to modeling or plastering of manifestations of psychopathology. For example, the content of delusions, the auditory hallucinations, obsessions, phobias are subject to cultural context in which the pathology is manifested. Patho-elaborating effects. Now, certain behavior reactions are universal, but these behaviors may become exaggerated to extreme in some cultures through cultural reinforcement. For example, as seen in the phenomenon of trance and possession. Pathofacilitative effect, facilitating effects of culture makes it easier for certain psychopathologies to develop and increase their frequency. For example, a liberal attitude towards weapon control may result in more weapon-related violence or homicidal behavior. Cultural permission to consume alcohol freely may increase the prevalence of drinking problems. Lastly, the pathoreactive effect. Now, how culture influences how people perceive pathologies, label their disorders, how they react to it emotionally. This culture guides them in expressing their suffering, and culture shape the responses of their folks to these clinical conditions. For example, better prognosis of schizophrenia in developing countries like India due to family support. Family, social, cultural factors have pathoreactive effects on schizophrenia, resulting in different prognosis. Now, the classification. Firstly, true culture-bound syndrome, a dissociative phenomenon, amok, lata, piblok, tok. Anxiety states like koro, dhat, and attack the nervois or attack of the nerves. Affective somatoform, brain fog, or shenjing shuario, and psychotic states like buffet deliranti. Then classification based on the illness attribution. This can be induced by anger, fright, witchcraft, by evil eye, by induced by perceived organic disturbance or dhat and sanguidermida. Now the questionnaire, the cultural formulation interview, is a set of 16 questions that clinicians may use to obtain information about the impact of culture on key aspects of an individual's clinical presentation and care. It is a brief, semi-structured interview and follows a person-centered approach. Now let's talk about the culture-borne syndromes in India. Firstly, possession states. This is mostly seen in women as the female to male ratio is 2:1 of ages 15 to 35 years. Along with India, this is also seen in Sri Lanka, and this follows a subacute conflict or stress, presents with non-specific somatic complaints, altered behaviors like stereotyped and culturally determined behaviors, aggressive or violent actions full of partial amnesia. Possession is episodic and the outcome is variable. It can be voluntary or involuntary, causing distress, could be a part of religious or cultural rituals. Dhat. Dhat is derived from the Sanskrit word dhatu, meaning metal, but also elixir. It was first described in Western texts by Vick and most commonly seen in young males of low socioeconomic status. Dhat syndrome has been studied in South Asia, including India, rural areas of Nepal, Sri Lanka, Bangladesh, and it is rooted in Ayurvedic traditions about bodily production of semen as representing an end product of energy demanding metabolism. So whitish discharge in the urine is assumed to be semen, and this loss of semen is associated with somatic symptoms like weakness and exhaustion, severe anxiety, hypochondriasis, and sexual dysfunction. Similar syndrome in India, the Jiriyan, this also has a similar thing like Dhat. Now, Bhanmati sorcery, this is seen in South India. It is believed to be due to presence of psychiatric illnesses like somatization disorders, conversion disorders, dysthymia, anxiety disorders, schizophrenia, etc. However, the nosological status of this is still unclear. Guilleri syndrome. Now, Guilleri is also known as squirrel or lizard syndrome. It is prevalent among the regions of West Rajasthan. And as for the individuals suffering with this, they describe it as a little blood-filled swelling on the body, changing its position now and again, as though a squirrel or lizard is moving inside the body from the back and reaches the neck, prompting obstacle of airways. Koro. The fear or delusion that the genitals are retracting into the abdomen, that death will occur once this has happened. And elaborate measures are taken to prevent the penis from retracting. Example, grasping of genitals, herbal remedies, and even fellatio. This is predominantly again seen in single young males in Asia and Middle East, like Thailand, China, India, northeastern states like Assam, Singapore, Israel. The female equivalent or the fear or delusion that maybe your nipples are retracting, that is cut out, seen in India. Suddu. It is a culture-specific disorder of excruciating pain in urination and pelvic heat, recognizable in South India, particularly in Tamil culture, occurring in both males and females, and refers to an increase in inner heat of the body, frequently due to dehydration, mostly occurring due to high temperatures amid summer season, long travel, lack of healthy foods, fluids, and lack of sleep. Now, ginginia. In vernacular, gingini means tingling and numbness. As tingling and numbness are presenting symptoms of the disease, hence it is known as gingini. It was as an epidemic first reported in the village in West Bengal, and the disease struck an individual unexpectedly with sensation of tingling and numbness in the leg, which spread upward all throughout the body. Suchi-Bai syndrome. This is seen in Bengal, and customs influence individual conduct to a degree which verges on pathological level. A vernacular term Suchi-Bai in Bengali dialect means a condition like obsessional neurosis. This is mostly seen in widows when they are asked to make a lot of changes in their lives. For example, they are asked to focus a lot on cleanliness. So it develops in them specifically. Ascetic syndrome. In the first place, it was depicted by Neki. This disorder is seen in teenagers and youthful grown-ups. It is portrayed by social withdrawal, serious sexual restraint, routine with regards to religious austerities, and absence of worry with physical appearance and excess loss of weight, as can be seen in the picture. Now, culture-bound suicide. Sati, firstly. We are all familiar with the act of sati. It is an act of self-immolation by a dowager on her spouse's fire bed. It was initially practiced by the Brahmins and Kshatriyas, but has been prohibited in India since 19th century. We all know by Raja Ravi Verma. Now, the Johar in Rajasthan, it is a suicide conferred by the ladies even before the passing of her husband, when looked by the prospect of shame from another man, normally an overcoming lot. Usually, when the battle was lost, so the women, the entire women of the entire household, they would commit this together. Now, Santara or Salekhna, in this, people deliberately surrender life by fasting unto demise over some undefined period of time to attain salvation. This is seen as part of Jain community and is believed that the individual will get rid of their anger, ego, attachment, greed, old age, and terminal illness. Now, interestingly, we have mass hysteria. It is where hundreds to thousands of individuals apparently accepting and carrying on in a way that they usually don't. Atypical hysteria epidemic. This was first reported in a tribal village of Tripura, where 4 males and 8 females were affected by it within a span of 10 days. It is self-limiting and individual shows improvement within 1 to 3 days. Now, the clinical features are attempts of self-injury, running away, inappropriate behavior, inability to identify family members, refusal of food, intermittent mimicking of animal sounds. Now we have amok. This is seen in the Malaya or Indonesian cultural regions. We have now come to other culture-bound syndromes. This seems to occur only in young males. This is also like a dissociative episode, which is characterized by period of brooding, outburst of aggressive, violent, homicidal behavior, precipitated by a perceived slight insult. Then persecutory ideas, automatism, amnesia, exhaustion leading to a return to pre-morbid level. Lata, this also again has Malaysian Indonesian origin, but this dissociative episode is seen in women. This is also due to hypersensitivity to sudden fright, exaggerated, startled response following a traumatic episode, screaming, cursing, dancing, hysterical laughter, lasting for about half hour or more. And in this, the women, they try to imitate the people around them. Now, brain fog, this is seen in college or high school students, mostly talked about in West Africa, seen after an intensive period of intellectual activity, characterized by watering of eyes, dizziness, difficulty in concentration, pain, fatigue, shaking hands, and rapid heartbeat. Attack de nervios or attack of nerves. This has a Latino descent, and symptoms of intense anxiety, physical and verbal aggression are seen, along with dissociative experiences, a sense of being out of control, seizure-like or fainting episode, usually following a stressful event, along with total or partial amnesia for the episode, seen in females with disrupted marital status and of low socio-economic status. Biblock talk. Now, this is interesting. This is Arctic hysteria. This is seen in Arctic and the subarctic Eskimos. This is again an abrupt dissociative episode following the loss or perceived loss of a valuable person or object, characterized by brooding, depressive silence, loss of consciousness, wandering, echolalia, and tearing of clothes, characterized by extreme excitement up to 30 minutes, followed by convulsive seizures even up to 12 hours. Similarly, in the Arctic region, there is a myth that is known as Wendigo psychosis, a mythical monster. This is associated with a mythical monster, and this is also reported in Eskimos. The supernatural being possesses the individual, which produces cannibalistic urges in them. Now, during the times of starvation in Eskimos, symptoms concerning the alimentary tract, such as loss of appetite or nausea, from trivial causes may sometimes cause the patient to become greatly excited by the fear of being transformed into a Wendigo, which is like a monster. Now, Shenjing, this is weakness of the nervous system. In Mandarin, the syndrome is composed of 3 out of 5 non-hierarchical symptom clusters like weakness, emotions, excitement, nervous, pain, and sleep, physical and mental fatigue with gradual onset, social and interpersonal stressors, dysregulation of bodily channels, conveying vital forces, weakness and health imbalance due to depletion of vital energy. Now, let's come to family suicide, which we discussed earlier. This is seen in Japan when encountering severe difficulties like financial ruin or disgrace. Japanese parents, they may decide to commit suicide together with their young children. Why? Because it is based on the belief that it would be disgraceful to live after such a shameful event has happened, and that shame would be relieved only by taking their own lives. Why do they take their children's life? Because they believe that young children, if left orphaned, they will definitely be mistreated by others. Now, again, anthrophobia, it is interpersonal fear in Japanese, characterized by anxiety symptoms and tend to focus on the impact of their symptoms and behaviors on others. This is mostly seen in males, and the onset is between 15 to 25 years of age, characterized by fear manifesting in the presence of people of intermediate familiarity. For example, the people you are not really familiar with, who are your acquaintances, like your classmates or your colleagues. This is different from social phobia, wherein the patients have fear of socializing with complete strangers, not acquaintances. Now, the variants of this anthrophobia are erythrophobia, fear of facial flushing, fear of having an offensive body odor, olfactory reference syndrome, fear of maintaining an inappropriate gaze. They have a fear that they are either maintaining too much or too little eye contact, fear of showing stiff or awkward facial expression or bodily movements. Now, these are of two types. They are sensitive or offensive. Sensitive, the people here are concerned about how others might be viewing them, and offensive, they are concerned about how the others are affecting them. Ghost sickness, this is in the North American, the Native Indian tribes of there, characterized by weakness, bad dreams, feelings of danger, confusion, loss of consciousness, suffocation, fainting, dizziness, preoccupied with death or with someone who died. The cause is considered to be ghosts or witch and may also include hallucinations. Now, this is interesting, something that we have seen in social media and everywhere. Voodoo death and sorcery fear, magic fear induced death. This is mostly, however, seen in African Americans and Hispanics. The typical voodoo ceremony includes short-lasting, voluntary, ritual-induced hysterical, psychotic states, trance-like states, convulsions, excitement, and twilight states. The belief in the possibility of being involuntarily possessed by evil spirits, this induces chronic hysterical and psychosomatic symptoms. There are voodoo deaths, fatal consequences, and the patient's belief that he is the victim of some kind of a black magic or of an evil spell that has been cast upon him. The underlying death may be a state of shock produced by overstimulation of sympathetic or parasympathetic systems. Many deaths may be also due to poison, if they have an underlying organic illness, or the victim's refusal to eat any kind of food or water. Now, the Malgary syndrome, this is seen in the Aboriginal tribes of Australia, again associated with anxiety-like symptoms and believed to be cured only by washing themselves in fresh water or seawater, depending on the case. Zar, this is seen in North African and Middle Eastern society. Here also there is being possessed by a spirit, a deity, and is characterized by further dissociative episodes. Now, buffet deliranti, this is seen in West Africa and areas of Haiti, mostly seen under ages of 30, characterized by sudden outburst of agitated, aggressive behavior, marked confusion, psychomotor excitement, acute, non-affective, non-schizophrenic psychosis characterized by visual auditory hallucination, but there is complete remission in this condition. Now, the treatment. The clinicians are advised to know or search about the demographics of the local population or the area being served. They should recognize that a local pattern exists, naming conceptualization, naming vocabulary, explanation and treatment of pattern of distress that afflict a community. Then talk with the family members and learn about local customs or search out other modes of documentation. Persons within the culture almost always recognize that one of their own is acting in a deviant manner. Their input can be extremely valuable in making an assessment of mental disorder. Now, how to treat possession syndrome? It includes careful exploration of underlying stress, which precipitated the aforementioned attack. Also, to decrease any kind of secondary gains the patient may be getting from this kind of a behavior. Then the treatment of Dhat syndrome, Vick suggested emphatic listening, non-confrontational approach, reassurance, correction of wrong beliefs, along with use of placebo, anti-anxiety or antidepressant drugs, whichever may be required for the patient. Depressive symptoms of this syndrome showed effective response to SSRIs, along with regular counseling, sex education, relaxation therapy, and medications. Sex education focuses primarily on anatomy and physiology of the sexual organs, as is practiced in our setting as well, wherein we show a diagram and everything and try to psychoeducate the patient. Then treatment of includes assurance and educational counseling, Lastly, the importance of these cultural concepts is to firstly avoid misdiagnosis, to obtain useful clinical information, to improve the clinical rapport and engagement, to improve therapeutic efficacy, to guide clinical research, and to clarify cultural epidemiology. These are my references. Thank you.
Very interesting topic. Questions, comments, clarifications, pharmacy terms, immediate symptoms. Any questions? What is the title of the presentation? Why? Supposed to be in the hands, no? आपके बात क्या लगता है? Is it you think about culture board? हाँ मतलब कुछ what the latest diagnosis system has to say about it? Latest diagnosis system ये सब टाइप culture bound syndrome भी यूज करता है कुछ और एंटिटी यूज करता है
ICD-10 are unfamiliar with some possession that is included in the dissociative in F44. Also, these are concepts of PDX or then so like that. So sir, it talks about it in different terms.
So DSM-5 is related bound to that. So DSM-4 is saying cultural distress signals. As per the DSM-5. ICD-11 has not come with any. So DSM-4 had 25 culture. DSM-5 has I think 9 and ICD-10 had I think around 15. But ICD-11 their working group is still working. Not still. Why they are narrowing the concept? Why they are moving away? ICD-11 has not even included this in the main section. What could be the reason? Good discussion, right? Culturally appropriate. So maybe वो एक disorder है भी कि नहीं है ये नहीं पता. You know, Wendigo psychosis, as she explained. So Wendigo psychosis, you know, when researchers went to those places, they found कि जितने भी case reports थे, those were only hearsay. They were not direct explanations. वो ऐसा था कि गांव में आपने कोई बाबा जी पकड़ लिया, उनसे सुन लिया, हमें publish करें. So many of them are actually not direct narratives. The cases, they are indirect narratives. So are they valid enough? हाँ, सारे नहीं है, सारे नहीं. सारे नहीं. Then, हाँ, ICD-11 में ऐसे क्यों नहीं? There's a reason. I see DSM-5 also trimmed it, fewer categories, fewer uses because they found only those are the valid ones. इतने सारे हैं. What the reason is? Srinivasan is to interview of social psychiatry. They used to take more medicine. क्योंकि अगर बीमारी हो जाएगा क्योंकि वहाँ पे मोबाइल साइकियाट्री क्लिनिक अवेलेबल होता है तो पानी की तरफ से आपको भी बहुत दूर जाना. But we are discussing about the validity of culture. why the ecosystems are going away from the
Probably increasing awareness amongst people to do.
Culture. Yes, you're right. Culture bound means a culture across the world. Across the world, who can across the world, there is an intermixing of a lot of cultures. We are adopting Western culture. They are adopting other cultures. So there is a diffusion of. So maybe down the line, few decades, there will be no cultural differences also. So that is why culture bound syndromes is a big because of the movements, migrations and all. It is not that valid enough. And the plethora of presentations, they are actually cross-cutting the boundaries of various psychiatric diagnoses. So इतनी सारे pictures हैं, इतनी variations हैं. If you see the definitions of Dark syndrome, what individuals are they, subsequently there are again variations in that. एक और amazing चीज है कि which nation is most culturally diverse? India. हमारे से एक ही concept of syndrome, which is the famous. बाकी सब तो those are more of an historical ones like Sati and all. और कोई cultural bond syndrome हमारे यहाँ का established है literature में. Indian. South India का आपने जो बताया था. So anything there? Gas syndrome. Yes. Gas syndrome है? है? India का है. वो ऐसे social website से बता दें it's established not. Gas syndrome.
All of these they mentioned in my article. So these are the established ones.
Established. In our Uttarakhand, cross culturally that is prevalent. That's another separate diagnostic entity. So, and DSM-5 says that every disorder we are taking the cultural context. So DSM-5, इसलिए we have not put emphasis on cultural bound syndromes. Culture को हर psychiatric diagnosis में consider करने की कोशिश करते हैं. One more thing, can you explain those pathoplastic, pathoselective? Last time what ताने ने किया था same. वो है क्या मतलब क्या उसको in simple terms समझा दो. हाँ.
लेकिन अमेरिका में कुछ तो कल्चर में
अमेरिकन की बहुत सारे
अमेरिकन इंडियन कैसे बताते.
Any syndrome you know of? जैसे हमारा evil eye वाला है, black magic कर दिया इसलिए हो गया, काला जादू कर दिया, नींबू मिल गया, नींबू चढ़ा दिया, कटा हुआ नींबू मिला, ताऊ जी ने कर दिया, चाची ने कर दिया. So what is any cultural bound syndrome is defined by this. Voodoo तो थोड़ा सा और strong वाला हो गया, उसका depth भी आ गया. Voodoo भी कैसे?
लोग बोलते हैं कि इसमें पर इसकी एनर्जी नहीं है.
Melody moon. Melody moon is, if you read Melody moon, there is characteristic culture bound syndrome which we find. ये ऐसा कर दिया, ये लाइक हो गया. Melody moon, I think voodoo के other terminologies, voodoo is little bit more stronger. फिल्म से भी दिखाया जाता है. What I have seen is 8 to 10 patients of Muslim community, middle-aged females, coming with my right hand is out. Right? It doesn't work. रात में सोती हूँ, जैसे काम करने का टाइम होता है तो ये मूव ही नहीं करता, बहुत दर्द होता है. Ultimately, all those are psychosomatic. Give them little higher dose of antidepressants, they improve. And if this hand is not working, you won't be able to work. नहीं करने से फायदा मिल जाएगा. Maybe a culture bound syndrome, and then husband will be very anxious. Not a conversion disorder as such. They'll be able to move it, but they'll say नहीं. रात जैसे काम करने का टाइम आता है, रात को बहुत बुरा लगता है. You won't find it. That is an It is a more of an you feel that mass hysteria or something. Maybe a case of shared delusion.
Only a family.
Huh?
Only a family.
Only a family. उसी तो मूवी क्या कर रहे हैं ना, सिमिलर टू So you need to pick up. See why in India this is not reported, because we as psychiatrists don't report it. We also come up with something. We can also give it a fancy name, and it will be, if it comes in a journal, we'll report it. As simple as that. So we have to also find that is there something unique in this region from this party region. And also you can see there's a lot of mixing of psychopathology also. Transient possession are mostly secondary for PCA. Primary transient possession, most of them they actually have underlying primary secondary disorders. In this sense,
The pathogenic effect. So, like for example, in Dhar, it is said that in the Indian society, semen is basically an end product. So the loss of that end product will definitely lead to exhaustion. So a male, whoever is a little insecure about things like that, he may develop something of the similar sorts if he sees like a whitish discharge, because in India they are very prone to infections as well. So rather than considering UTI or something like that, they would consider this first. Then it's a pathoselective. The population will select something out of their population that has already happened. Population which has gotten a certain kind of recognition. So okay, if we do this, this is okay. Our community is going to accept it. Then so next in pathoplastic, so it colors their perception. Like example, a pujari or somebody who's a Brahmin, who's a God-fearing man, his auditory hallucinations are mostly going to be about gods. They're mostly going to be about the deity or everything. And
so like the illusion of black magic.
Yes.
So if some pujari will come, he'll come with the illusion of black magic. Yesterday we met pujari. You see his themes are like that. You will not say that it is not challenge. We will not call it a delusion because it is culturally accepted. So it is pathoplastic delusion. Yeah.
So that is pathoplastic. So patho elaborating, they get this motivation from other people in their society. Like in a Jagar, in the states of Uttarakhand, like 4-5 people are being possessed at the same time. So seeing the other person, this sort of felicitates their gains
What do you call
also.
this? Jagar.
Yes.
I think video will release with YouTube.
So it's very common, sir. It's in US, specifically it's done in the areas of SMEs. And so patho facilitated, like if the culture allows that kind of, for example, being abusive towards their wife or after drinking alcohol, it's normal for them to do that. So the incidence of domestic violence that case will increase in that kind of an area.
ठीक है, comments? बस आपको what are you thinking? Brain? Fog is okay.
I mentioned it. I wrote it for rather than.
Brain fog को बताइए. ठीक है. बताइए. बताइए. हाँ हाँ. How many papers are there in gas control? I think yes. Why not? You screen them the whole OPD maybe for a month and see how many percent of the patient have gas control. It's easily acceptable. Any question? तो बेसिकली आपको आइसोलेट तो मिलेगा नहीं, वो उस पिक्चर में मिलेगा, तो आधे सिम्टम्स मिलेंगे। एटलीस्ट प्रोपोर्शन ऑफ ना, इतने में गैस सिंड्रोम है विद ऑल एसोसिएटेड विद, बता सकते हैं बिकॉज़ ऐसे तो मैंने बहुत ज्यादा पेपर्स करते हैं, चेक करिए। So I think Shani has presented well, very well, I would say. But my point, difficult topic. But what is this more than seminar? It's a group discussion is she is the facilitator for a group discussion. आप लोग पढ़ के नहीं आए, इंटर्स पढ़ के आए हैं, इंटर्स साइंस से नहीं आए, तो कैसे होगा ग्रुप डिस्कशन? तो आपको पढ़ के आना है, you have to discuss, you have to ask, you have to imagine, है ना, क्वेश्चंस ऐसे कोई कभी कभी तो आपके अंदर क्वालिटी होती है कि आप कुछ भी पढ़ के नहीं आए फिर भी आप क्वेश्चन पूछते हैं, क्वेश्चन बहुत अच्छा पूछो, भले बहुत टफ क्वेश्चन भी हो सकते हैं, वो मतलब कॉमन सेंस ना, इंक्विजिटिवनेस कैसे कि समझ नहीं आया ऐसे कैसे, अब ये कैसे किया पूछता है तो हाँ प्लीज प्लीज
you don't take it as a disease. So how can you tell them that it's because I myself, if it is affecting their work quality, if it is affecting their family life, if it is affecting the people around them, not for just that particular period of time. Like it usually is a trans statement, so it goes after 10 to 15 days. But if it is prolonging, it is being a hazard to everybody around them. So that is when we come into picture. Sometimes things like this, culturally, that's what we are talking about, that they are a little acceptable. If the people around her and everyone is doing that, so it is okay, it is acceptable. They need to know this, that, and they cannot straight away tell them that this is wrong, this is not something that is true, and this is a false belief. This is your culture, we accept it, we respect it. But again, if it is like prolonging, and if it is being a hazard, then it is a problem. Only then we will.
I still remember there was this video about this jigar, and a reporter called, I mean, what are your views? So I said that all these points, the culture bomb thing, and the video showed that there were school students in the park of the school, very small, and they all were dissociated. And the Panditji came, and then they were falling around. You know, you saw also that video. So what happened? He was recording everything over the phone, and he released that video, the audio records, in his news channel without our permission. So he was doing it with a psychologist, another psychologist, not from any institution. She said it's a drama, it's a matter. है ना, ये तो सब बीमारी है और ऐसा है वैसे, very bluntly, and all people very hurt and they made it an issue. You have to be very, very careful in these contexts, that you have to communicate very respectfully, respecting the emotions, the culture, the context, and also possible pathology in these contexts, not hurting the emotions. Like, movie थी ना, कौन सी थी वो अक्षय कुमार की फिल्म थी? नहीं गॉड वाली जो थी, ओ माय गॉड, उसने बोला था ना कि अगर आप लोगों से उनका भगवान छीनोगे तो आपको सीख. So we have to be very, very careful in cultural context. You are forming psychopathology. As a psychiatrist, my advice would be to be away. In any controversial circumstances, don't jump on this pathology. Culture was strong over there, try to step away. Otherwise, it might cause conflict. Okay. Then you can use things like sensitive brains, sensitive mind, sensitive personality, more prone. Enough of these kind of people, rather because reporters would want some sensation, and then you might like those. But those are cultural understandings. कोई पेशेंट हमारे पास आया जाता है पूजा मिले हम शुरू करते हैं सब बात करेंगे. Until unless patient has psychosis, we say that सामने मत करेंगे, किसी को करा लीजिए. Challenging those can be easy. You never know that you might land. डॉक्टर अदिति लास्ट टाइम सेम सेमिनार में शेयर की थी, बताइए क्या शेयर की है? मुझे ये याद है कि आपने क्या शेयर किया. शी प्रेजेंटेड द पैनल प्रेजेंटेड सेम सेमिनार. that you were not well, in your family someone was not well, they did some black magic or something. That's not-
So basically, what happened was that